Hey everyone, and welcome to the AI Now Partners podcast, where we dive into real conversation with leaders driving innovation across insurance, operations, and impact driven technology. I'm your host, JK Jetomo, and today I'm thrilled to welcome someone who's making a real difference in the world of youth sports safety and pediatric healthcare, Charlie Wund, the founder and CEO of InjureFree and the Agency for Student Health Research. Hey Charlie, thanks for being here. I'm really looking forward to learning more about how you're using technology to tackle risk and improve care for young athletes.
Yeah, absolutely. Thanks for having me, JK.
You're welcome. And to kick things off, could you tell us a bit about your background and what led you to start InjureFree and the Agency for Student Health Research?
Yeah, I think most founders, I think there's a passion for sports. I grew up being an athlete. I played a bunch of different sports in college, football for 4 years. I played lacrosse, rugby, and then I ended up getting back to baseball, which was one of my early sports growing up in high school. And so naturally, I kind of continued that path into the world of athletic administration and then began working with larger groups of kids inside of high schools and YMCAs, et cetera. I think the NFL concussion lawsuit that was back in around 2005 really was a catalyst for me knowing and seeing firsthand, experiencing a lot of problems where there was a lot of debate around safety and physical activity, and saw that as an opportunity to create solutions and try to continue to protect the youth sports environment in a meaningful way. And so that's really what set us on the path of creating InjureFree as a injury documentation service. The data that we collected through that process is what really springboarded us into the insurance world, understanding what's happening in the ecosystem, where the risks may be, what might be preventable, what might be something that's a larger concern. So that was really a turning point in our development as we grew, which is ultimately how we ended up in the insurance world.
Wow, that's a powerful origin story, especially coming from someone who's lived on both sides of youth sports. Well, let's take a step back and look at the bigger picture you're operating in. What major shifts are you seeing in youth sports safety and student health over the last few years?
Yeah, there has been an increase in compliance, adherence, and understanding that there's a need for compliance. I think my personal understanding or take on that is that there's a larger shift in the space where the private equity backed organizations are starting to move in and really driving a lot of that risk management mindset that is protecting their investments and the capital that's being infused into the market. So I think that's where a lot of it's coming from. I also believe that there's a lot of now former athletes that are parents like myself who have kids that are going through the ranks and understanding that there were a lot of problems when we were playing 20, 30, 40 years ago that we don't want our kids to have to go through, and we're looking for ways to solve those problems. So a lot of your youth sports administrators now are a second or a third or fourth generation of an athlete who are solving problems. So a lot more altruism in the space to protect the athletes themselves. So I think those are really the key drivers, those two components, to why we're seeing a lot more compliance and compliance adherence inside of this space.
Well, you're hitting on something big. There's a clear need for coordination between schools, healthcare, and families. And that's where technology becomes really important. And speaking of technology, how has technology changed the way you approach injury reporting and care coordination in schools and youth sports?
Yeah, the exciting thing is that there's always something new, right? And I think that's what's exciting, especially when we talk about AI as a tool or anything else that's being developed that we don't even know about. Technology as a software platform, there's many, many, many new developments there, but also create issues with friction or fragmentation that need to be understood and in some way overcome. So I think that those are very exciting opportunities. We also need understand that we also need centralization. And that's where I think we're seeing larger advancements now, where organizations are not working in silos as much. There have been and is now more adoption or a mindset to adopt the European models and more of a global sense of how sports are being run, with more authority and autonomy from a top-down approach, which is then driving the centralization of the operations. So those are very exciting pieces. I think what's also on a hardware side, very exciting about new sensor technologies, GPS tracking, that provides a unbelievable amount of data for an individual or for larger programs as a holistic what's going on in my ecosystem and my larger populations that we need to be aware of. So I think those are the two fronts that primarily drive innovation and help administrators really get the data they need in meaningful components. I think, it's one thing to be able to collect a bunch of data. It's another to actually display it and provide it in a meaningful way for administrators so that they can make actionable decisions. That's really ultimately where data needs to be. So I think, those are the areas where we're seeing a lot of good, strong innovation across the board, and excited to see what the future can bring in the next 3-4 years.
Right. Streamlining communication in a fragmented ecosystem is no small task. I imagine regulations or public health policy also play a role in how you implement your platform. And have there been any major shifts in healthcare policy or insurance that have changed how InjureFree operates?
That's a good question, how we particularly operate. I mean, I think that the larger shifts are more of the regulation. I mean, going back to 2009, the first state concussion law was passed in Washington. And then every state had to say a similar type of model by 2012. That was a very quick adoption of new regulation and governmental, I think, impact. But it was almost a rush. And so now there was a second wave, I think, from 2012 to 2020. And it's in a lot of ways, it's still happening where legislative rewrites are occurring or amendments to the existing laws where they're realizing that we missed a few things on the first path. So they're trying to plug some of those holes from an authority basis, but also from a regulatory environment to ensure that there's a standard of care that's being delivered. We've always taken the approach that there are always going to be new updates, new approaches, new science, new technology, and new governmental regulation. So we've built a communication tool that allows us to update those types of notifications in real time. So when a new policy is administered or a law is created, that there's an opportunity for us to alert everyone that change has occurred and make sure that they're immediately in compliance, whatever those new trainings may be or workflow processes that might need to be developed. But I think that, overall, going back to one of your original questions, folks are starting to understand there's a lot more that goes into athlete safety and student safety, and that needs to be taken seriously. It's not just something that's a CYA type of a mindset. It really is to own it, understand it, live it, breathe it. Things like emergency action plans. Not everybody has one of those, but they should. And it's a daunting task, but there are ways, again, with AI or new technologies that we can generate those types of programs and policies very quickly so that it's not such a heavy lift that makes everybody feel better ultimately if they should need to be put into play. So an emergency action plan, something that people can follow and adhere to. So I think that, we're doing what we can to help provide solutions in a speed to market. That's always been our mentality and our mindset. It's just a matter of keeping our fingers on the pulse of what those changes are, what those new expectations might be, and ultimately making sure that our clients and the organizations that we work with are all in the know and sharing information about what new changes or regulations may be coming so that we could stay ahead of it. But that's never going to be a cycle that's going to end. It's going to constantly go on and evolve. So we just want to make sure we've got the communication channels established so that we can quickly deploy when those new regulations do come down the line.
So, what's your main focus today in growing InjureFree and the Agency for Student Health Research?
Yeah, I mean, we've continued to stay true to our mission, which is just advancing the market in its understanding about athlete safety and ultimately how we can provide tools in that space to organizations and to families who are in need of that support. It is a mindset of how streamlined workflows in risk management and space sorts safety can operate, and then having those tools to be able to provide that. Currently, right now, we're working on a lot of health system related opportunities, ensuring that students have the proper insurance coverage that's extremely affordable. We just released a new product that's $20 for families to get 6 months worth of coverage for their child, but it has a $5,000 limit. So it's about coordinating the benefits of these voluntary products with their high deductible healthcare plans that typically are found in the employer marketplace, eliminating gaps and then making sure that those athletes have the coverage to be able to get the medical care they need. That's a big piece of what we're working on right now. We're also working with a lot of our partners on coordinating medical care and streamlining that. We also know that going to the emergency room, for example, isn't always the best option, even if it's a broken arm. There are better ways to get higher quality care that will ultimately reduce the amount of time it takes to heal from an injury, but also
Right.
then the costs that are associated with that care are reduced. So that benefits the families, that benefits the insurance companies. Everybody in that ecosystem wins when we can streamline that entry point into the medical system. So how do we do that? How do we educate parents and folks on why
Mm-hmm.
those valuable processes exist and how these solutions can work? And that's really where a lot of our work today is focused, is equitable care in and around healthcare for athletes at all levels.
Wow, that's actually really helpful, and that's good news for everyone. Like you said, it's a win-win situation with most of like everybody. And you mentioned about partnerships and scale. What are the internal indicators that help you track progress or performance?
We use a measurement of lives covered. So in our populations that we work with, how many athletes are within that pool. We look at the total volume then of what those injury reports may be. We want to see a downward trend ultimately is what we're
Mm-hmm.
looking for in our populations. And we can segment those out by location or population ecosystem, whatever it may be. So ultimately, those are the key drivers for us, is that we're doing what we can from a prevention standpoint to reduce the volume of injuries. We're also tracking claims, making sure that those numbers are going down as well. And then, of course, we look at speed to claim completion, if you will. So once a claim is started, how long does it take for that case to finally be closed out, either if there
Mm-hmm.
is a payment that needs to be made, et cetera, et cetera. So those are some of the pieces that really we look at from a customer service standpoint, and making sure that people are seeing the value that we can provide with our products, that ultimately tell us that we're doing a good job. We're seeing a lot of people in our ecosystem. We're seeing those trends decline. And then ultimately, we're seeing if they are injured, getting quality care, getting their healthcare claims closed out as quickly as possible. Those are really our main focus.
Well, those insights are really invaluable, not just for your team, but for the entire, youth health ecosystem. And I want to talk about how people actually find you. How do you typically build new relationship? Do health systems, school districts, or insurers approach you directly?
All the time. That's part of our inbound, sales lead, if you will, folks that are reaching out to us or find us via the web. Any one of our portfolio companies has their own specific website that they can go to, or Google searches typically pick up those kind of who am I looking
Mhm.
for. We do use LinkedIn a
Right.
lot because we work with organizations. So we are more of a B2B service, and we're looking for those types of thought leaders who want to make improvements, but also just need support or guidance, advice.
Right.
That's where we can help support them there. We also get a lot of referrals too. So we'll end up we work with athletic trainers a lot, for example, and an athletic trainer may be working in one school or district and then move and relocate to another, but they're familiar with our product or service and they would want to use it in their new location. That's another way that we end up scaling. But word of mouth, and I would say your general kind of Google search type of web search functionalities are how most people find us.
All right. Well, that type of collaborative entry point seems to create real traction based on what you're saying. And now, looking ahead, where do you want to take this next? Like, what are your goals over the next 12 to 36 months for the platform and your overall mission?
So 12 to 6 months, 6 to 12 months, we've got a pretty short window of new products that are coming out, both on the insurance side specifically, but also in our software. We have a lot of new platforms that are being developed to serve these ecosystems that do overlap and then centralize. So we're excited about by the end of this year with what we're going to be able to offer our clients currently, but also the larger market from a consolidation. The one thing that we continue to hear is the biggest pain point is really volunteer compliance and tracking. How do I take all of my coaches, my volunteers, my parents? How do I make sure that they did go through the required credentialing that is necessary for a preseason or in order to coach within a season? And then who has not? So how can I see at a glance, which people
Mm-hmm.
have and have not completed their requirements?
All
That
right.
tool and functionality is set to release this year before the end of the year, which we're super excited about. So there's some new products that we're going to be releasing. High school sports pretty much start tomorrow, at least here in California. August 1st is really the starting point for most of the high school sports across the country, although everybody's pretty much working already today.
Right.
And so we're in a ramp up phase right now with the new school year starting, and then shortly after that, we've got a renewal cycle in a lot of our youth sports organizations with their larger insurance policies that we're going through. Once all of that dust settles and we get into October towards the end of the year, we're kicking off a lot of exciting research projects with some nationally based organizations. So we're working on a ACL injury prevention program right now that is going to be super exciting. We're excited to look forward. We're looking forward to collecting a lot of data and then reporting on that data in Q2 of next year. So we've got our hands full on really launching, getting up and off the ground on some new initiatives, but also just getting back into the school year cycles and then some of the youth sports cycles and tournaments that start to ramp up after to the summer months. So this is kind of a calm before the storm as things start to get crazy, literally starting as of today, which is August 1st tomorrow.
Well, yeah, that's right. And that's a compelling vision, especially given how underserved this space can be sometimes. And I want to ask, do you see demand growing more on the healthcare side, education side, or somewhere else?
Definitely the healthcare side and in the youth sports model. So, we separate the youth sports into two different groups: high schools, which has about 8 million athletes, and then the rest of the youth sports community, which is about 32 million. That larger pool is where a lot of the private equity movement has been. So we're seeing a lot more demand coming from that pool, which is great because that's the biggest population and that's where
Right.
we want to fill a lot of cracks. Healthcare, though, is ramping up. I think there's a lot of concerns around, I mean, healthcare in the United States is a different topic, but the fragmentation within the healthcare industry, as well as the financial strain that is being put in healthcare as a larger market, is requiring a lot of typical health system partners to remove their services from the education departments or the education market, which is creating a void. So we are seeing a lot of health systems reaching out for helping us to bridge that chasm between them and the school market,
Mm-hmm.
which is interesting. So we're looking at, some of our partnerships and ways that we can create new models to support those entities and really understand better about where the pain points are and how we might be able to help streamline that communication as well. So it's exciting on the healthcare side, I think, but the more exciting for me personally is how youth sports administrators have taken to the understanding of the importance of risk management and safety. And so we're seeing those larger populations now starting to ask for a lot of the same solutions, which is great. That's what we want to see.
Well, with that being said, you're clearly in the middle of some very meaningful change. And that brings me to this actually. What's the biggest challenge on your plate right now? Or what keeps you up at night if there is?
I think what's hardest in our space is really education. A lot of
Mm,
folks who are in administration, either in the school side or in the youth sports markets, didn't go to school for risk management. They don't necessarily understand insurance, and even as parents, it's a necessary evil in a lot of ways, or viewed that way, and can be complex. And so I think that that's a barrier for us that we're always trying to overcome, which is helping individuals understand at a very basic level what are the nuances, but or more importantly, what are the ways and the solutions that we can implement to help overcome some of the issues they may be having. But it starts with education. And so if
right.
everybody in the world knew how it all worked, I think we'd probably be in a better place. We have problems and issues that need to be solved. We wouldn't be in business if everybody had those deeper understandings. So it really is the education component. We are largely waiting for folks to come to the realization that they have an issue that they need to deal with. Once
Mm-hmm.
they get to a point where they understand or they've been told there's a problem, or that maybe they have concerns and they're not sure if they have a problem, that's when they reach out to us. We'll do some kind of assessment or check, and then we can provide them that education on very specifically. It's not general statements about how insurance works or what
Mm-hmm.
risk management means for you sports. It's here are your areas, here are your blind spots specifically in your ecosystem. And we can start that education process in a very nuanced way that's meaningful to the client that we're talking to with real case scenarios. So, that would be the biggest hurdle that we deal with is not everybody thinks, hey, I haven't had a concussion reported in 10 years. So I don't have any problems. Likelihood is that you have a number of kids going through your program over the last 10 years that have suffered concussions. You may just not know about it. Or
Right.
parents take their kids away from youth sports practice and then they go to their doctor without telling you what's going on. And that's where the gaps in communication come into play. So I think market education is probably our biggest uphill climb as a company, as an
Mm-hmm.
organization. but we're well versed. Once we have somebody who has that open mind and understanding or just curious nature, we can walk them through. And a lot of times we tell them, hey, you're doing a great job, just keep it up. Or here's a laundry list of issues that you need to deal with that could come back to get you later on in life. So we try to work through that in a nuanced way to solve that solution.
Well, that's right. And these are complex problems, and it's inspiring to hear how you're going after them with both tech and mission in mind. And Charlie, thank you so much for sharing your time and your work with us. It's really making a real impact. And before we wrap up completely, I know people will be curious on where they can find you and, get in touch. So can you tell us where can people find you or Injure Free online if they want to learn more or get in touch?
All of our software is kept with InjureFree.com, and there's a number of services there, including per diem athletic training staffing that we can provide through that website. And then all of our insurance products, both on the B2B and on the B2C side, for the voluntary products that we provide under our Cover Sport line. Those are all found at GetAmsys.
Got it. Perfect. We'll make sure to include those links on the show notes as well. Well, Charlie, thanks again for being here. It's been a pleasure speaking with you and learning a lot from your perspective.
Thank you, JK. Appreciate you having me again.
Thank you.